Good day. The following video is a recording of the Tactical Combat Casualty Care Lanes of Expert Field Medical Badge Testing, which was recorded in April 2023 utilizing the June 2022 grade sheets. The video depicts a standardization train-up of graders demonstrating the lane to EFMB candidates for the first time. Please note that the EFMB Test Control Office requires candidate uniforms to be different than those depicted in this video during testing.
Would you like to say any acronyms you might use on the line?
Yes. CAP-BLS is formations, contusions, abrasions, punctures, penetrations, burns, lacerations, and swelling. TIC is tenderness, instability, and crepitus. PRD is progressive respiratory distress. I'm just saying
okay.
the acronym.
She's going to say them. All right. You guys can take pictures of all the acronyms up there, right?
Okay. Thanks a lot, let's see. Buds is blood, urine, defecation, secretions. Can we just skip this?
Yeah. No, we're good. All right, awesome. All right, so just for this demonstration, she said all her acronyms. All right,
I
awesome.
did it when I actually did my lane. Okay, I know the acronyms.
All right.
Hey, sir, you got the badge. We don't. Nobody's judging at all.
So I'm gonna start with the scenario. So a small team. This might be it. This might not be it. Okay. So a small team of U.S. soldiers from the 3rd Brigade combat team sustained an ambush attack during a patrol near Pay-Pee-Shire in northeast. You are the sole soldier close to scene with the best field medical experience. Your mission is to find all the casualties and provide their appropriate care in accordance with Medical PAM 350-10. Do you have any questions?
No, sorry.
All right. Zeros on the clock. Bang, bang, bang! You've gained fire superiority.
I see one casualty, 25 meters, 12 o'clock.
The bright red bleeding has stopped.
Keep going. Slowly lower.
Alright, so the first thing I would do is reassess my tourniquet.
Right, we can stop.
I would establish 368 perimeter.
Security in place.
Hey, are you okay? Can you tell me what happened?
Patient is unresponsive. No blood. No blood. No blood. No blood. No blood.
Okay. 360 security is still good.
Still holding.
Hey, can you hear me? Can you tell me what happened?
Patient's unresponsive. No blood. No blood. No blood. No blood.
I'm going to expose, assess, and check for an exit wound. Holding pressure for 3 minutes
3 minutes has elapsed.
and ensure the gauze is extending 1 to 2 inches above the wound.
What's the height?
I'm going to flex the casualty's knee, feed the cravat under the belt. And tighten the belt. Just tighten it off. Alternate the tail. and ensure that I'm covering all the gauze as I wrap. And tie a non-slip knot. And secure it with tape. With 3-inch tape. One and a half times around. Oh, son of a biscuit. Straighten the casualty's knee. And swath both legs together 2 to 3 inches above the knee. And then I would continue to assess for further bleeding.
Bleeding is controlled.
Sorry. PSI.
The airway's not painted?
And assure the head is in a neutral position and look for airway obstructions.
There are no obstructions.
And I measure my NPA. Lube it up. I'm gonna reassess.
Airway's not painted.
Select the appropriate size for my casualty. Head tilt, chin lift. Scissor method.
The patient gag plate is intact.
identify the cricothyroid membrane. Cleanse with an alcohol wipe. Stabilize the larynx with a non-dominant hand. Reconfirm. And then do a 1-inch vertical incision. Reconfirm. And do a horizontal poke through the membrane. I'm going to elevate the cricoid cartilage. And insert going towards the lungs. Inflate the tube with at least 10 mils of air. Ensure my placement is correct by auscultating both sides.
You hear breath sounds in all lung fields.
Thanks.
I'm going to place a pulse ox on. And listen for spontaneous respirations for 10 seconds.
In 10 seconds, you observe 4 respirations and the patient has a pulse ox reading of 94.
Okay, they do not need to be ventilated. So I'm going to apply a dressing. Secure it in place. PSI. Head tilt, chin lift, let's listen and feel.
The airway's not patent.
Okay, I would place an NPA in him.
That's good.
Okay, then I reassess.
Airway's patent.
Okay. PSI. Expose the torso and visually and manually rake for any penetrating chest wounds on the front. Don't see any. I'm indicating that they're going to need a pelvic binder because they have a lower limb amputation. So I'm going to grab a pelvic binder. The reason I'm doing this now is because in your grade sheets it says you can log roll them, so before I log roll him, put pelvic binder on. I'm going to place it over the greater trochanters. visually and manually sweep for any penetrating chest wounds on the back. Don't see any. While I have him log roll, I'm going to perform step 13 of the detailed assessment. So I'm going to look for decap BLS of the back. I'm going to palpate along the spine for tick and step off. And then I'm going to swipe for buds. Since I just log rolled him, I'm going to assess my previous interventions. Those are good. Then I would observe for signs and symptoms of tension pneumothorax using
The patient is not showing any signs and symptoms of tension pneumothorax.
okay. And yeah. But I said thorax. That sounded weird. Okay. BSI. Expose and visually and manually sweep for any penetrating chest wounds. I find one. I'm going to wipe away any blood with gauze. And apply a chest seal on exhale, exhale, exhale. This is non-vented, so I would ensure that it extends 2 inches around all sides. He is also going to need a pelvic binder because he has this wound here. So I'm going to grab a pelvic binder. Yeah. Expose the back. Oh. And then visually and manually rake. Oh, I found one. It's crazy. Huh? I'm gonna wipe away with gauze. And then On exhale, 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 I would place directly over the wound, ensuring that it extends 2 inches on all sides. Since I'm here, I'm going to look for decap BLS. I'm going to palpate along the spine for tick and step off. I'm going to swipe for buds. Since I just moved him, I'm going to reassess all my prior interventions. Good. And then I'm going to assess for signs and symptoms of tension pneumothorax using PT Doc.
Your patient is showing signs and symptoms of tension pneumothorax on the right side.
Okay, so first thing I'm going to do is burp this chest seal, peeling it back and wiping away any blood or clots. Exhale, exhale, exhale. I'm going to do an NCD. I'm going to go mid-clavicular on the second intercostal space above the third rib. Huh? I'm selecting the appropriate size needle. I know that because it's an NCD. And I'm going to insert at a 90-degree angle to the chest wall. I'm going to hold for 10 seconds to allow air to escape.
10 seconds has elapsed.
And I'm going to re-secure, or not re-secure, but I'm going to secure it in place with tape. BSI. Okay, so they already have a pelvic binder on, so I don't need to worry about that. And they don't have any tourniquets that I need to convert. So I'm going to assess for signs and symptoms of hemorrhagic shock. So I'm going to check AFBU again. Hey, are you with me yet? Can you hear me? Nothing. I'm going to check bilateral radial pulses.
Weak and thready.
And I'm going to assess color, condition, and temperature.
Pale, cool, and clammy.
Okay, so you will need an IV. I realize that like none of you are going to be able to see this. Do they have an arm over here? apply constricting band. Cleanse the site with alcohol. Uncap the needle. Pull the skin taut distal to the site. Bevel up. Insert at a 20 to 30 degree angle. Drop down and advance a little bit. Then I'm going to advance the catheter. Do you have a sharps?
I'll just take it.
Back here.
Okay.
He's got it.
Clean the saline lock. That's not a saline lock. Did I do this one? Gonna aspirate and flush with at least 5 milliliters of water. Saline. And then they need TXA, or they're gonna need TXA. So that's 2 milligrams, slow IV, IO push immediately, but within 3 hours. PSI. He already has a pelvic binder on, but he has a deliberate, or he has a hasty tourniquet, so I'm gonna convert it to a deliberate. That's 2 to 3 inches above the wound, or amputation in this case. I would expose it first. It's already exposed. Deliberate, so it's going directly on the skin. And then I would slowly loosen my hasty tourniquet and look for bleeding.
Bleeding is controlled.
I'm gonna wrap circumferentially with tape. And mark it with time. Just I would not tighten the windlass. Then I'm gonna assess for hemorrhagic shock. Hey, are you with me yet? Can you hear me? Nothing. Checking for bilateral radial pulses.
Weekend ready.
And color, condition, and temperature.
Helpful and climbing.
I'm also gonna do an IV for him. Okay, and they're also gonna need TXA. Okay, so that's it for circulation. BSI, I'm gonna treat for hypothermia. He's already on the blanket, but I would wrap him up. I need to gather vital signs. Since these two are both unconscious, altered mental status, so both of them are gonna keep safe. Okay, O2 and pulse or heart rate.
So the heart rate is 80, the O2 is 94.
And I still have radial pulses.
Present.
So that's 80 over P blood pressure. And looks like respiratory rate.
16.
And then I'll check his allergy information, which should be in his IFAC. No known drug allergies. So I would administer pain medication now. So I'm gonna go with option 3, which is ketamine, 20 to 30 milligrams, slow IV IO push, because he is unconscious and I think that he might go into shock or is already in shock. So that's why I'm giving option 3. And then for antibiotics, I'm giving ertapenem, 1 gram, IV push once a day, because he can't take anything PO.
Dose, or how often are you going to give ketamine?
Ketamine is every 20 minutes until pain control or nystagmus. And then ertapenem is just once a day. BSI. Control for hypothermia. I need to take his vitals. Looking for O2 and heart rate.
O2 is 94, heart rate is 80.
And I still have bilateral radial pulses.
Weekend ready.
And respiratory rate.
16.
I'm gonna check his IFAC for his allergy information. He has no known drug allergies. I'm gonna give him option 3 and ertapenem as well, because he has this NCD, so he's in progressive respiratory distress. And then ertapenem, I said that already. DCAT BSI. I'm going to start my detailed physical starting with the head. I'm going to look for DCAT BLS. I'm going to palpate for tick. I'm going to check for battle signs, raccoon eyes, pearl, and then I'm going to look for CSF and blood coming out of the nose, mouth, and ears. And I'm going to look in the mouth for any broken teeth or foreign objects. Moving down to the neck, I'm going to look for DCAT BLS. I'm going to palpate along the spine for tick and step off. And I'm going to look for JVD and tracheal deviation. JVD is jugular vein distension. Moving down to the chest, I'm going to look for DCAT BLS and equal rise and fall of the chest. I'm going to auscultate apex, apex, base, base. I'm going to palpate for tick. And then I would assess for PRD, respiratory distress. Moving down to the abdomen, I'm going to look for DCAT BLS. I'm going to palpate for a turd. Tenderness, rigidity, and distension. Moving down to the pelvis, I'm going to look for DCAT BLS. I'm not going to palpate because they have a pelvic binder on. And I would look at the genitals for any mutilating injury or pooling of blood. Moving down to the lower extremities, I'm going to look for DCAT BLS. I'm going to palpate for tick. And I'm going to check PMS. I can only do pulse because they're unconscious. Moving up to the upper extremities, I'm going to look for DCAT BLS. True. That would be much easier. I'm gonna look for DCAT BLS, palpate for tick, and checking PMS. I can only do pulse because he's unconscious. I already did the back, so I don't need to worry about that. And then I'm gonna check vitals. O2 and heart rate.
O2 is 94, heart rate is 80.
Still has pulses.
Weak and thready.
And then respiratory rate.
16.
And I would continue to assess every 5 to 15 minutes for I5. BLS. Or BSI. BSI. Okay, so looking at the head, looking for DCAT BLS. I'm going to palpate for a tick. I'm going to look for battle signs behind the ears. Raccoon eyes. I'm going to check pearl. I'm going to look in the mouth for any teeth or foreign objects. And I'm going to look for blood and CSF coming from the nose, mouth, and ears. Moving down to the neck, I'm going to look for DCAT BLS. Palpate along the spine for tick and step off. And I'm looking for JVD and tracheal deviation. Moving down to the chest, I'm going to look for DCAT BLS and equal rise and fall of the chest. I'm gonna palpate, or not palpate, auscultate apex, apex, base, base. I'm gonna palpate for tick. And I would continue to assess for PRD. I'm gonna move down to the abdomen, looking for DCAT BLS. I see an abdominal evisceration. So I'm not going to palpate. I would flex the casualty's knee and turn the head to the side. Making sure not to put any pressure. I'm just going to secure this through the pressure bar and then set the excess down. And screw this thingy. I don't remember what it's called. What is it called?
Locking bar.
The locking bar. Fastening clip.
Oh, there you go. Secure with tape. Moving down to the pelvis, I'm going to look for DCAT BLS. It's a pelvic binder, so I'm not going to assess for tick, I'm not going to palpate. And then I would look at the genitals for any mutilating injury or pooling of blood or fluids. I move down to the lower extremities, look for DCAT BLS, and palpate for tick. Amputation, so I'm not going to palpate that for tick. And I'm going to check PMS, just pulse on this one side. He's unconscious, I can't check motor or sensory. Moving up to the upper extremities. I'm going to look for DCAT BLS, palpate for tick, and check PMS. I can only do pulse, not motor or sensory. And I already did the back, so I'm going to initiate vitals. looking for O2 and heart rate.
O2 is 94, heart rate is 80.
Still have pulses.
Weekend ready.
And what's their respiratory rate?
16.
Okay, I would continue to monitor every 5 to 15 minutes for I5. And now I'm going to initiate documentation via the TC3 card.
Y'all can get up or you can go to the next one.
Broken.
Oh man, anything else that you're aware of?
My eyes in.
Okay. Alright, lay back. Actually, I'm gonna remove your weapon, okay? Just precautionary, but he's up and alert and talking to me, but I'm gonna remove his weapon anyways, because he might go out, you know? Alright, lay back down. I'm gonna start my blood sweep. BSI. So my casualty is talking to me. You're good, right? Okay. Any troubles with your airway? Okay. He's awake, so I'm not going to give him an NTA because I know that his airway is good to go. It's patent. BSI. All right. I'm going to take your flick off. Okay. We'll get that arm taken care of, okay? I'm just gonna assess some other things first. Okay, I'm gonna visually and manually sweep for any penetrating chest wounds. None. He is not gonna need a pelvic binder, so I'm just gonna get my litter up so that I can log roll him onto it. Just watch your arm there. Okay, I'm gonna log roll you. Just watch this arm, put this arm overhead for me. Alright, and then you can help me out. I'm going to log roll you onto me, okay? And then back onto the litter. Okay, so I'm going to expose the back. I would cut this, but I'm not going to cut his actual shirt. I'm going to visually and manually sweep the back for any penetrating chest wounds. I don't see any, but I'm going to look for decap BLS. I'm going to palpate along the spine for tick and step off. And I'm going to swipe for buds, and then I'm going to roll you onto this litter, okay? You can help me out with that. Okay, ready? He's not going to need TXA, so and I don't have any interventions that I've already done, so I don't need to reassess those. But just to make sure, I would continue to reassess for PT doc for PRD.
He's not showing sign.
Okay, BSI. He doesn't need a pelvic binder. He has no tourniquets to convert. So I'm just gonna assess for hemorrhagic shock. So are you good? You feeling okay? Okay. Yes.
Pulse is present.
Okay. I'm gonna remove your headgear up there. Checking for color, condition, and temperature.
It's normal.
Okay. I'm just gonna initiate an IV on him anyways, just in case we need it later.
Neutralized.
Okay. And he's not gonna need TXA. Okay, so BSI, I would wrap him up to prevent hypothermia. And I'm gonna gather vital signs. O2.
Pulse is 80, SpO2 94.
And then respiratory rate.
16.
And he still has pulses.
Present.
What's your pain scale on 0 to 10?
10.
Check for allergies. Sorry. No drug allergies. You don't have any allergies?
No.
Alright, so I'm going to give him option 2, OTFC 800 micrograms. And then you can you take something by mouth you can swallow? Okay, then I'm going to give him oxyfloxacin 400 milligrams PL once a day. Okay. So, yeah, BSI. And I'm going to start my detailed physical assessment. Okay, so I'm going to look for decap BLS. I see the laceration of the eye, so I'm going to treat that in a second. I'm going to palpate for tick. I'm going to check pearl. Can you open your mouth for me? I'm looking for any broken teeth or foreign objects. Okay, you can close it. I'm going to look for raccoon eyes, battle signs behind the ears, and then I'm looking for CSF coming out of the nose, mouth, and ears. Okay, you can sit up for me. Okay, so I'm going to treat this laceration of the eye. What's going to make ear the lawyer?
2.
Okay. Can you read this?
U.S. Army.
Okay. I'm going to check for cobbles, and then looks to be a laceration of the eye, so I'll treat that. That other hand, can you hold this over your eye? I'm gonna wrap around both eyes. And then hold this in place for me. Okay, you can lay back down for me. Moving on to the neck, I'm going to look for decap BLS, palpate along the spine for tick and step off. I'm going to look for JVD and tracheal deviation. Moving down to the chest, I'm going to look for decap BLS and equal rise and fall of the chest. Palpate, auscultate, apex, apex, base, base. I'm going to palpate for tick. And I would continue to monitor for signs of PRD. I'm going to move down to the abdomen, look for decap BLS, palpate for turd. Moving down to the pelvis, I'm going to look for decap BLS, palpate for tick, and I'm going to inspect the genitalia for any mutilating injury or blood pooling. Moving down to the lower extremities. I'm gonna look for decap BLS. I would cut these away. I'm gonna palpate for tick. I'm gonna check PMS. Checking for pulse. Can you push down on my hands? Which toe am I?
Super toe.
Okay. Moving on to the upper extremities. Can you sit up for me and help me take your top off? I'm gonna look for a decap BLS. I'm gonna palpate for tick.
Ah!
Okay, and then I'm gonna check PMS on both. So pulse. Can you squeeze my hand? Okay, and which finger am I? All right. So can you hold on to this arm with this hand? Okay. First thing I'm gonna do is check PMS. Or not PMS, but pulse and cap refill. I'm gonna remove any jewelry. Hold on to the either arm again. I'm gonna put it on a splint. Okay. Alright, hang on there. Gonna wrap it. Check pulse and cap refill again. And then I'm gonna circumferentially wrap with tape. Apply a sling. I'm gonna go under this arm. And then yeah, you can lay back down. I already checked his back when I log rolled him, so I'm gonna get vital again. Looking for pulse and O2.
Pulse is 80, SpO2 is 94.
Radial pulse is still present.
Present.
And respiratory rate.
16.
What's your pain at now?
8.
Okay, and then I would continue to assess every 5 to 15 minutes for I5. Checking pulse and SpO2.
Pulse is 84, SpO2 is not, sorry, correction. Pulse is 80, SpO2 is 94.
And still has a radial pulse.
Present.
I'm gonna check respiratory rate.
16.
What's your pain now?
8.
If you don't have any drug allergies, okay. Are you taking any medication?
No.
Has anything like this ever happened to you before?
No.
Okay, what was the last thing you ate?
An MRE at 1300.
And what were you doing just before this happened?
I was on patrol and I was under fire.
Okay, we're gonna get you out of here, buddy.
Somehow she just lost
Time.
Sometimes she just